Sam, thank you for always making these packets for us.
Yes,
It is so
absolutely.
helpful. Jess Smith just joined on Zoom too. So
Okay.
you're unmuted now.
Okay, it's 4:30, so I will call the meeting to order. I'm Sandra Larson, the current chairperson of the Dubuque County Board of Health. We'll start with roll call. Let's see here. Give Adam a minute more here. Tom Betchum.
Here.
Marshall Horowitz here, Sandra Larson here, Jessica Smith
Here.
Amy Crow-Sunley
Here.
Hendrik Schultz. Hendrik did say that he might show up around 5, I think. He could be here around 5 on Zoom. And Adam Hoffman. Okay, so we have 5 people in attendance, 3 here in the office and 2 online. But due to the storm, we're under a tornado watch tonight. So I think we can go ahead with the meeting with the people that are present and the ones that are on Zoom. So does anybody have any opposition to that? Okay. At this time, anyone may address the board on matters of which are on the agenda. Please raise your hand on Zoom, state your name and home address. Individual remarks are limited to 3 minutes. Anyone on Zoom? Seeing none, we can go on. We now have Adam Hoffman is here in the room with us, so we do have a quorum in the room. As far as announcements for me today, I just have one thing. Our recruiter has some personal family issues on July 7th and 8th. So she asked us to come up with some dates for the next week, if we could possibly. And this is for in-person interviews in July. So she's looking at the week of, it's July 10th through the 16th. Tell me, let's just start, I guess we'll start with who's not available on Monday, the 11th.
Monday and Friday don't work for me.
No Monday, no Friday.
I need to look at my calendar here. Hold on.
Okay. Okay, Tom?
Monday would work for me, but why are we having another delay? We're getting, every time we turn around, we got another delay, and it's getting, we need this person.
I know, and I did speak to our recruiter, Maureen Berry, about that. She is the sole caregiver to an elderly father, and he's having surgery on, I believe it's the 5th or 6th of July, and she was just concerned as to whether she would be able to get out here for the 7th and 8th.
All right.
So,
I guess my question, Sandra, is she the only one that's running this program?
she's ours for Dubuque County in this particular position, yes.
Okay.
I told her that I would check with the board to see if we could come up with available dates. If we can't, then I guess we'll just leave them on the 7th and 8th and fingers crossed that she doesn't run into a problem. But let's keep it going here and see if we can come up with a couple of other dates. Is anyone not available on Tuesday?
I have a 9:30 a.m. conflict.
Okay. And then later in the day, you would be okay?
Yes.
What about Wednesday? Anybody not available? And then Thursday? Anyone not available on Thursday? So what about Wednesday and Thursday? Sounds good? And those dates are
13th and 14th.
July 13th and
And we're
14th.
gonna do the same 2 o'clock.
Yes. All right, thank you. And it shouldn't, she told me that it should not delay our timeline, so hopefully it will not.
Okay, so what were the times on the 13th and 14th?
2 o'clock and after. And that's for in-person interviews. So people, the committee got to see for the first time today the applicants that we'll be reviewing on Friday, this Friday. And we do have applicants from the East Coast, the West Coast, and the Middle West. So we have them from all over the country. So if we happen to choose some of those that are from a distance, they'll have to do some traveling to get here. So the week of the 13th or July 13th and 14th might even be better because it's away from the holiday. So
Yeah, that's true.
okay, thank you. I don't have any further announcements, I don't believe. So we can move on to the Board of Supervisors, Board of Health Liaison. Or Supervisor McDonough.
Good afternoon, everyone.
Hi.
I do not have anything to share other than I'm hoping everyone is aware that our Director of Human Resources, Dawn Sherman, has resigned, and Friday is her last day.
Yes, we were aware, and we are waiting, I guess, for some. She said that she would talk to us. Dawn Sherman will talk to us on Friday. We have a meeting to review the applications about like contact people and that type of thing once she's gone. So
I saw that email. I saw the copy of the email that you sent. She has not been in the office this week, so.
okay. All right, well, thank you. And next we have the approval of the agenda. Are there any additions or corrections to the agenda? Seeing or hearing none, is there a motion to approve the agenda?
So moved.
Second,
Second.
it's been moved and seconded that the agenda be accepted. Are there any comments, any discussion? Hearing none, let's take a vote. All those in favor of approving the agenda, please say aye. Aye.
Aye.
All those opposed, say nay. The agenda is approved. The next thing on the agenda is the approval of the minutes. Are there any additions or corrections to the minutes?
Just under 3, just change the O and the R around in the name. The little typo, it's all right. I've been called worse.
Typo.
Okay, any other additions or corrections to the minutes from June 1st, 2022? Hearing none, is there a motion to approve the minutes?
This is Jess. I'll motion.
Thank you. Is there a second?
Tom, I'll second.
Thank you. Any discussion? Hearing none, all those in favor of approving the minutes, please say aye. Aye. Those
Aye.
opposed, say nay. The minutes are approved with the one correction. Presentations and reports. Samantha, do we have any questions or comments from the public that we need to address today?
No, not today.
Thank you. And then the next presentation will be from the Health Department's own Bailey Avenarius, and she's going to be speaking about grants to counties, fiscal year 22 final review. You're on.
Hi, everyone.
Hi.
So just an update on our grants to county fiscal year 2022 end of year report. Just some overview. Grants to county allows us to test private wells in Dubuque County. And it also assists with the cost of well pluggings and reconstructions and shocking of wells. And we currently test for coliform bacteria, E. coli, nitrates, arsenic, manganese, and that's all of them. And then the total cost of each or all the cost is $160 for all 4. And then this is just one of the ads that we had posted in the newspaper. And then this is just another one. Okay, so a little breakdown. We were awarded $40,400, and we've spent the whole $40,400 with a total of 244 water tests, one plugging of the well, and then one well closure, and then one reconstruction. And this is just a breakdown of all the different cities in Dubuque County that we tested in. We did not test in Luxembourg or Cascade, but we, going forward, will be making sure that we do get testing in those 2 cities.
And there wasn't any specific reason we weren't testing in those cities. Most of the tests we did this fiscal year came from people calling into our office based on the ads that we saw. So it wasn't like we intentionally left out Cascade or anything like that. But it is good to know for next year so that we can target Cascade when we advertise to make sure that people in that area are getting tested for clean drinking water also.
Can I just comment? I'm sort of surprised to see how many well tests were done in the 52003 Dubuque zip code, because that's where I live and I don't know, I mean, that's city water mostly.
Key West.
Key West would be, okay, okay.
Out that way, there's a lot of private wells, and there's still
Okay.
some that are hooked up to private well water in the city too, that
Okay,
have yet to switch
it's just
over.
interesting.
Yeah, we tested a lot in like St. Donata, or I should say like Massey Station. We did a lot in Massey Station, kind of out by Route 52 South, out in that area.
Okay. Good work.
And this is just another breakdown of the different contaminants. So I can't see. Sorry, you can't really see that. So there was 21 high nitrate levels, 10 E. coli present, and then only 1 high arsenic. We don't ever really see high manganese or high arsenic.
Coliform was the highest that we found. Of the 244 that we tested this year, 50 of them came back positive for coliform.
And then moving forward into fiscal year 23, so we've calculated that we have to test a minimum of 75 wells for each quarter, which equals up to 6 water tests per week. And our testing days are every Tuesday. We currently have 37 on the list starting July 5th. We get to spend up to $500 for testing supplies, $1,000 for promotional. And then we'll just continue to promote grants to county on our county website, Facebook page, the local newspaper. And then we will also be searching for different trainings to spend $1,000 in training that we are awarded. And then for fiscal year 23, we will be rewarded $50,505. And we have started that application, which is due June 30th.
That's all. I guess I just wanted to point out that this is the first year we've spent all of our funding, and we've spent it before the end of the year, a month ahead of schedule. So I'm really excited about that. I think Bailey's put a lot of work into this grant. And we've set up tracking systems so that we can look at the types of contaminants that are in the water, the zip codes we're testing, and those were things that weren't set up before. So that's going to help us a lot testing in the future, and making plans for what type of Dubuque County residents we want to provide this free testing to.
And I too would like to pile on with thanks, because I think both Bailey and Sam did an awesome job getting out there. So in years past, that's been a huge issue, but you guys really, rose to the occasion, did a wonderful job. So, so first, congrats.
Yeah.
Secondly, can we make a map? I know you said like zip code stuff, but
Yeah.
like we can go like GPS stuff with map stuff to see like,
Oh, yeah.
are we
It's interesting.
concentrated with
Interesting.
nitrates
Yeah.
here or
Yeah.
there?
Yeah, we definitely can do
Awesome,
that.
that'd
We
be
just
really
hadn't
cool.
done it
Yeah,
yet.
where
For sure.
all those contaminants are.
To see if it's kind of lots.
Right,
or-
just to see if, yeah. And then, and you mentioned it, Sam, and Bailey, would you agree that most people are getting it from newspapers, or where do you think, what do you attribute to the more tests to, other than your guys' obviously just getting the word out a lot more?
I would say the newspaper and word of mouth. We've
Okay.
had a lot of neighbors call in wanting their well tested, or their neighbor got it tested and they want to get theirs done. And we do also send out letters, so that really helps as well.
Wonderful, thank you.
Now, who are letters sent to?
Letters are sent to people that we've noticed tested with us in the past, or people that we know are on a private well.
Okay. And then what happens if it is positive for coliform, then do you have to do follow-up?
We do call them with the results, and then we give them different resources for mitigation, but Grants County does not cover the mitigation. So
Do you have, are you often called back to retest, or
sometimes,
if it's sometimes? Yeah.
Grants County won't cover the cost of a retest though. The
Okay.
retest is on the homeowner.
Oh.
Grants County will only cover one test per year for each address.
And so we just then hope that the owner is going to take care of the problem, and
Yeah,
you think that they
unfortunately,
would want to, but.
right. Yeah, a lot of them come back to retest again and they shock and do the 10-day wait, but we can't make them do that. We don't have funding to support them doing that, unfortunately.
So this is Supervisor McDonough, and I'm very thankful, Bailey, and thank you, and Samantha as well, for completing the Grants to Counties program for the year. But if this is a need and there's citizens requesting, I'd like to see you at least consider as a board next steps. Perhaps should be some additional funding from the county. So if you're identifying a need and, and we have our new director, maybe there'll be some thought about that as well. But completing the grant is, in my mind, the baseline. And now it is the matter of what are the next steps. So when we have a new leader, and you may have some thoughts about that too. If we've completed it a month early and 30 days where there's no well, is that a problem?
Any other comments or questions? Thank you very much, Bailey, for the hard work and for the report, and thank you to Samantha for your help with that.
thank you.
Our next presentation will be the Dubuque County Health Monthly Update and COVID-19 Update.
So as of today, we're still at a low community level in Dubuque County. Since I last met with you, we kind of teetered back and forth between medium and low. But as of this past Thursday, which is when this gets updated every Thursday, we've been at a low level. These are a breakdown of our variants in Dubuque County by month. And as you can see, 100% of our cases have been estimated by the state hygienic lab to be the Omicron variant, and it's been that way since February. And for June so far, this looks the same for the state as a whole, and it's been that way since April for the state also. This is our trend line since the beginning of the pandemic in March of 2020 until today. You can see that we were headed back down in April, and then we've kind of made a spike back up in May and June. And that's reflected in our 7-day counts as a county. Our numbers are steadily increasing. Today, this table here is updated every Wednesday. And so today we were at 181 tests in the last 7 days. The incident management team continues to meet with our hospitals on a regular basis and check in with them. And you can see our hospitalizations are staying around 8 to 9. This table also gets updated every Wednesday along with the case count. This is a breakdown of our positive COVID cases by age in Dubuque County since we last met. And here it says that 30 to 34 and 0 to 10 are leading in 9% and 8% for those positive cases. This looks a little different than if you were to look at the pandemic as a whole in Dubuque County. And for that, the 19 to 24-year-olds are leading our positive case rate with, I think it's 12%. So who has had COVID-19? Unfortunately, we don't have Dubuque County specific data for this, but the US population of those with SARS-CoV-2 antibodies has increased significantly from 33.5% to 57.7% from September of 2021 to February of 2022. And across the board, all age groups have seen an increase in this antibody count, including children 0 to 11 who have risen from 44.2% to 75.2%, and children 12 to 17 who have gone from 45.6% to 74.2%. So I thought that was just interesting to share, and it shows you how widespread COVID has become. Will I get COVID-19 again? So those who are fully vaccinated and those who have previously been infected with COVID-19, the chances of getting infected with COVID-19 again are lower, at least within those 6 months after getting the vaccine or having COVID-19. But early reinfection within 90 days of the initial infection can occur. And we do not have an approved test that can reliably determine the protection from COVID-19. And then reinfection with COVID-19 with with a different variant is possible. So you could have one variant the first time and then get COVID again with a different variant the second time. That's not impossible. And then symptoms during reinfection are likely to be less severe, but some people can experience more severe symptoms their second time around. So with that, just a reminder to be sure to get your COVID vaccine and your booster when you are eligible. So going into that, this is some updated vaccination data as of today. 71% of the county's 5 and older population has either completed their vaccination series or is currently in the process. And 98.1% of the county's 65 and older population is in the same category, which is really exciting to see. 58% of our residents 12 and older who are already fully vaccinated have now gotten a booster dose. And one thing I'd like to point out is that if you break this down by age group, the younger you look, the less vaccinated or less boosted they are. And I think that's really interesting because those are also the age groups with the highest case rates. Our vaccination information is still available on our county website, and the Visiting Nurse Association is still offering walk-in clinics on every third Monday and every Friday at their office downtown. And then we still have our Sleeves Up phone line and our VNA phone line. And I believe as of Thursday, the VNA had received 299, I think it was, calls to the line since we opened that line on January 21st, I think it was. So the incident management team is working to push out more vaccine promotion through social media. And so these are just 2 examples of some different posters that we're going to be posting out in the community and on Facebook and Instagram. Testing information hasn't changed much since we last met. If you're looking for self-administered test kits for free, you can get rapid test kits from Crescent Community Health Center or through the federal program where you can order them online and have them shipped to your house. And then if you're looking for self-administered PCR tests, you can get them for free through Hardig Drug or through the Test Iowa program. And those Test Iowa kits are at our department here, also at the VNA, and then a few other locations in the county. And you can find the full list of those locations at testiowa.com. And then if you're looking for in-person testing that is free, Hy-Vee Pharmacy is still offering PCR tests. And then there's rapid testing at Epic Health and Wellness for a cost. And Crescent Community Health Center is testing those who are symptomatic or may be in need of like a doctor's note for any sort of return to work situation. I only had 2 other updates for you all. At the end of this week, on the 17th and 18th, the CDC ACIP committee will be meeting to discuss COVID vaccinations for ages 0 to 4. So that's to come still. And then as of June 12th, so earlier this week, the CDC announced that it is no longer requiring air passengers traveling into the United States to show a negative COVID test. Sorry, I'm noticing a lot of typos in this. Or documentation of recovery from COVID before they board their flight. So I just wanted to make everyone aware of that. Otherwise, that is the last slide, I believe. So if there's any questions.
I was wondering about the after action report. You had done a request for proposal or something. What's the status of that?
Yeah, we got 3 quotes from different agencies that are offering to assist us with our after action. And I was actually going to bring them to the incident management team meeting tomorrow
Okay.
to look at all 3. So, and then you and I and Stella had talked about budgeting for that. I think with grant funds, we'll be able to cover the cost of it. So we shouldn't have to go into the Board of Health budget as of right now.
Okay. And then I just wanted to mention that just before I came here, I read that the governor of Iowa signed the law that says that COVID vaccination cannot be required by schools or colleges and some other institution too, I think. So
Consistent with,
yeah,
you know,
science,
philosophy.
science.
Yeah, consistent with her philosophy.
Right. But I mean, so many other vaccinations are required, but this particular one won't be required in Iowa, so.
Kids have a whole slew of vaccinations that are required before they enter school. I'm not an expert on that, but I would think polio vaccine and smallpox are included in that battery, and I don't understand the science in her decision.
Right. All right, so let's see, our next agenda item.
Oh, I was gonna,
Go
sorry,
ahead.
2 more department updates.
Okay.
Aside from COVID.
Yes.
We did have a TB testing event since I last saw you all, and it was in partnership with the Visiting Nurse Association, Mercy, Crescent Community Health, Monsoon and Solidarity, and then the Iowa Department of Public Health. They're the ones who initiated the whole project. And we were able to get approximately 60 people tested for TB at the event, which I was pretty excited about. And then we're doing some follow-up care with those individuals who may have tested positive through the Visiting Nurse Association.
Do you know how many you did?
Yeah, about 15 of them.
15?
Yeah.
And they didn't know?
Yeah. Mhm.
Wow,
As far as I know.
that's great.
Yeah, so because that was such a high positivity rate, higher than I think we were expecting, we're looking to have future testing events to follow up. And then we also had our emergency preparedness drill at the training center across the street since I last met with you, and we had 45 participants come to that. It was a 2-hour training that ended up being 3 hours, which was good. They didn't expect us to have that much participation, so I was happy to see that. A lot of long-term cares were involved in the conversation, and I don't think they were as much previously before COVID. So that was a good conversation to have too.
Samantha, do we know how the x-rays are being funded? Are we funding those for the TB?
That is through the Iowa Department of Public Health.
Okay.
Yeah. Otherwise, that was all. Sorry.
All right, thank you so much, Samantha.
Yeah.
Thank you for the report.
Uh-huh.
The next agenda item is the Vna Monthly update, and I see Stacy Killian here.
Yes,
Hi.
thank you for having me.
Uh-huh.
So this is the first month we've tried out the new reporting system that Sam and I developed, and I think it worked really well for us. It was easy for us. And I think it shows better an impact and kind of where we at with each of the grants and the funding. And so I won't go through it line for line. I'll just give you a few updates. A few highlights. Our tobacco grant, our FY23 grant was awarded and will begin July 1. So we're currently working on negotiations with Iowa Department of Public Health. We have about 6.7% of the grant left, and we expect that will be fully done as it ends June 30th. So we've got a few more things to add to it, and we're wrapping up our billboard campaign, and we've reached a lot of individuals and a lot of presentations in the last month. So that information, that statistical information, is over the last May. And so immunizations, I actually just kind of started looking at this data, and I felt it was important for you all to see the number of children we vaccinated in the last 30 days and the number of vaccines that were administered, and then the number of clinics and appointment spaces, and then our no-show rate. And that 17% is actually lower than what it typically is. It usually runs between 25 and 30%. So we're always trying to look for different ways to make sure we do 2 reminders, one 2 weeks ahead of time and then the day before. And sometimes it can be a hard population to serve where we don't have accurate phone numbers and things like that. And so we are always trying to look to get that down, because we then take that 17%, we have to do follow-up and try and get them back in and get them back on track. So we're working through that. Our immunization funding there, as you can see, there's $0 remaining. We have a few funding sources for immunizations. We also get funding through Dubuque County Early Childhood. We can use some of our PHS funding for immunizations, because as you can see, $18,000 doesn't go very far, because that while the vaccine is free, we still have to pay for all supplies as well as staff time to administer any outreach, any marketing, things like that. So I thought it kind of really just showed where we at, and you'll see as the months go, as we get closer to school starting, those numbers will triple. And so the number of kids, especially in August, as we get ready to the back to school. Moving on, our BCC Wise Woman, we had 27 screening visits submitted through Care for Yourself and 5 through Wise Women. We also excitedly brought on a new provider that will accept our referrals for that program. So that's exciting to see. We have about 19% of our BCC grant remaining and 45% of Wise Woman. This grant's a little bit different than some of the others, because it's not where it's the time, but it's per screen. You get a certain dollar amount per completed screen. So we hope to see, and we anticipate that once we get all our screenings submitted, that we will bring that down too. And so our BCC grant, we've actually resubmitted for FY23. And then the Wise Woman grant, we found out today, will be released more towards the end of the month and due at the end of August. So that is our actual last one and to be released. So we expect to see that coming soon. Our PHS grant, that has a lot of different buckets. A big one is our homemaking home care aid visits. And as you can see, we've had a few discharges and admissions. And then we still have quite a long waiting list. So every time we discharge, we then do move towards that list to open up even more people.
Stacy, are those, excuse me, but are those 56 individuals on the waiting list, are those all Dubuque County?
They're all Dubuque County, correct? Yeah. And I think if I remember when I looked it up the last time, Sandra, I think about 15% of them, 15% were out in the county, and the remaining 85 were within the city limits that are on the waiting list.
And if we were to, if the Board of Health was to get money budgeted to do this, we could do more people, right?
We could absolutely do more. One of the struggles that we've had internally is staffing for this position. It's a hard position to staff for. It's a very independent position, and it's also out in the homes. There really isn't any office time. It's all out in the field. And so we've struggled quite a bit with staffing for this, but certainly with the staff there and the ability, we could.
Yeah, okay.
Yep. Our communicable disease, we have been very busy. As Sam mentioned, we had the TB testing event. So how that worked with the testing event, we had 58 individuals that were tested, and then all the results came into the VNA, and we contacted all 15 individuals. And then the 15 that did initially show positive, we've been working with either their medical home or Crescent to get them in for that x-ray to determine if they're active. And then we also did additional TB skin tests that we could not do on site that day. So we did COVID vaccines on site at that event, and then brought the TB skin tests into our office the following week, so we could make sure that the timeline to have that read, we were open and available and had staff there. And so I did not bring that number. I apologize on how many we've been testing throughout our office, but we've been continuing to do it since that event. We will follow up with all 15 individuals once they have their x-ray, and we will work with Iowa Department of Public Health to determine a course of action and treatment, whether or not they're active or latent. So it's been quite a bit of work, but we're getting there. We also had some tetanus, E. coli, and we're currently following some other TB cases as well, both active and latent there. So we've been staying very busy there. Next up, just some agency updates. We did put in here some information regarding our supplemental or deficit funding. As you can see, we've had an 80% increase in staff time for TB. The follow-up alone on this has been very difficult. And how it is with Iowa Department of Public Health with TB is once we get an active case that we have to provide treatment for, we get a set amount of money to do that. So any staff time prior or any additional above and beyond the funding that they give, then becomes part of our agency. So because all 15, we don't have any treatment options for them yet until they're fully seen and have those x-rays, we wouldn't receive any funding for that work as well. So it's been quite a bit, but as you can see, we've also had an increase of 6.5% of our staffing over the month of May, and a lot of that has to do with the TB follow-up and individuals coming in. We've also had some changes within our representative PE program. Our coordinator resigned, and so we've had some interim staffing overlap to try and get that covered to maintain the services we are currently provided. And we just filled that position this week, so we're working on orientation and training. So we're very happy with that. And one of the big things I wanted to share off our grant, and this is very new information for us, we were just awarded the Wic Grant. So Iowa Department of Public Health, a lot of what they've done with their grants this year is move it to more of a collaborative service area is what they call it, a CSA, and they're regionalizing a lot of grants. Where before you could apply for certain counties, now they lump counties together, and then that's the current CSA. And so WIC previously, prior to this change, VNA held the WIC grant for Howard, Almaquee, Clayton, Winneshiek counties. And then the new CSA also included those counties and Chickasaw, Delaware, and Dubuque. So an 8-county region. So unfortunately, that kind of put us in a position where we had to write competitively in order to keep our WIC services up north and add on the additional counties. So Hillcrest was the previous service provider for WIC. That will change October 1st, and VNA will start providing WIC services in all 8 counties. So a huge change for our office. We're currently working with Hillcrest on a transition plan because it will be seamless to the patients receiving the services. October 1 services will start immediately with our office. So we're looking at staffing and clinic planning and making sure that that goes very smooth. And Hillcrest has done a wonderful job with the WIC grant. Unfortunately, we were all placed in this position to competitively work on this grant, but they've been wonderful to work with in terms of this transition, and over the next few months, I feel like they will as well. What I feel is really important is we hold the maternal and child health grants. They're also regionalized in the same 8-county service area as well as first 5, and those are all your maternal and child health services. And currently VNA holds the child health grant in those 8 counties, the first 5 grant in those 8 counties. And previously we held maternal in just a few of the counties, but because of the change in the CSAs, we did apply for all 8 counties for maternal as well. And I think all of those grants strengthen and support each other. So it will be good for all of our programs, immunizations, lead testing, maternal health, child health, to have WIC within our office, and patients and families to be able to get all services they're eligible for. We also hope to see that by us having WIC out of the VNA office, we will increase lead testing drastically, which is something that we've really wanted to do. Our model with our WIC grant up in the northern counties was to lead test those that were coming in for WIC, and we weren't able to do that here in Dubuque, but we will moving forward in October. So that will really increase lead testing, which we're excited about. So big changes for us and very busy, but we're very excited.
Thank you for that report. Do you have anything further?
Yeah.
Thank you very much, and thank you for all the hard work. It's making a big difference in the county, and we look forward to continuing to work with you.
Thank you.
Let's see. The next item on our agenda are action items, and so A is set a public hearing for Chapter 69 Ordinance adoption. And this is our ordinances here in the county haven't been updated since the state changed their laws. And so it's just kind of it's something that we need to do. the DNR did call it to our attention earlier this year. I think I had pulled up, in your packet was that ordinance or the state
Yeah.
ordinance.
I didn't print it though, sorry. It's,
It's on,
Way
it's
too
on
long.
here, yeah.
It's 60
Yeah.
or 70 pages.
Yeah.
But I think what happens is we rescind our current ordinance and then we will adopt this, but we worked with our auditor, Mr. Dragato, and is he the one that said it needs to go on public hearing?
Mhm.
Okay, because I thought we could just do some language where we adopted by reference that particular ordinance, but so,
The way he explained it to me was if we set a public hearing at this meeting for the meeting in July, you can set aside a certain amount of time at the beginning of the July meeting for a public hearing and then vote on it after.
okay.
Yeah.
All right,
And that way we have a month to post the public hearing and let the community know that we're gonna be talking about that.
okay. All right, so the public hearing is just at our meeting.
Yeah, we can just tack it on to our meeting.
Okay, all right. Are there any questions? Does anybody have any questions about that? And Adam,
Yep.
I don't know if we have to like go line by line and compare this state law with our current ordinance and decide if there's anything in our current ordinance that we want to keep or not. Or just get rid of it altogether and put the new one in. So those are some things we have to kind of think about and look into.
Right, yeah, we can look into that, but I think the state's on almost every level more
Yeah.
strict than we are now, so I don't think there would be any benefit in us
Yeah.
backing it out, so, yeah. but I
Unless
can
there
do that,
was,
but I
and I
think-
don't know, I don't know if we have anything in our local ordinance that's, specific to Dubuque County or something. So we'll just have to keep an eye on that, and take a look at that before our next meeting.
Yeah,
So,
and Corey Frank didn't bring up anything
No.
that, and he was fantastic to work with
Right.
DNR. He didn't see any red flags that he,
No,
yeah,
no, he
passed
didn't,
along,
yeah.
so.
And Bailey and I can look through both too and compare and point
Okay.
things out to the board. The other reason we thought this would make the most sense is because when we had our contractor meeting, we learned that most contractors are pretty much just referencing chapter 69, which is the state code. They're not really looking at chapter 34, which is our local ordinance. So they're going with the stricter version anyway.
all right, well, good. We'll just get that. It's kind of a formality. We just need to get taken
Yeah.
care of. And we'll take care of that then right before the July meeting then.
We just have to vote to set the public hearing for
Okay.
July.
Is there a motion to set the public hearing for our July meeting?
I so move.
Thank you. Is there a second?
Yes, I second.
Thank you. Any discussion? Hearing none, then let's take a vote. All those in favor of having a public hearing concerning chapter 69 ordinance adoption just before our July meeting, please say aye.
Aye.
Those opposed say no. Okay, it passes, and so we'll have that public hearing concerning chapter 69 at our July meeting. Thank you, Samantha. And then the next item is a variance request for 16308 Country View Court. Do you want to talk about that or?
Yep, Bailey's on too,
Bailey's
so
on too,
I'll
okay.
let her talk more in detail, but there were a few documents in the agenda packet that showed photos of the variance that Tim's requesting, and Tim is here too if you have questions. And then the letter from Bailey with her recommendation. Bailey, do you have anything to add?
Yeah, so I visited with Tim about 2 weeks ago, and we took some measurements and determined that he does not meet the 10-foot setback from the septic tank to a structure, which would be the deck or the pool. So Tim is requesting a variance of 8 feet to install a pool and concrete deck in his backyard. So this would be 2 feet instead of the 8. The septic tank will still be accessible, so they can still pump the tank. And I don't see this as being a potential health hazard, but I do recommend that he get the water tested once a month for 6 months and test for total coliform bacteria and E. coli. And if it comes back absent every month, then testing once a year.
What is the actual distance from the tank to the pool? Is that 2 feet?
It would, yeah, so the tank, the septic, the end of the septic tank to the concrete deck would be 2 feet.
To the deck. I'm more concerned about to the pool.
The pool is farther.
The pool is what?
It's farther, so it'd be, the pool would be,
15.
Tim said 15 in the room here.
Yeah, because I would think that as long as we have clearance to pump the tank and inspect the tank from the deck, as long as we're maintaining the distance from the wall of the pool, I don't have a problem with it.
so it would still wouldn't meet the setback to the pool.
Oh, okay.
What should the setback be for the pool?
So any structure should be 10 feet.
But Tim, you said it's 15 feet?
To the edge of the pool is, from the edge of the septic to the edge of the pool will be 15 feet.
Is how much?
15.
15, okay, that's the ordinance, or that's the guideline. What is the actual?
No, Tom, that is the actual.
Cool.
And Bailey is telling us that 10 feet is the requirement. And so it's farther than the requirement, correct?
Right.
Is that, Tim?
What, well, a year ago, talking with Colin Dolphin, he told me the pool had to be minimum of 10 feet from the edge of the septic tank. And so I said, good, we made plans, spent a lot of money. And then in speaking with Bailey, she informed me that any structure had to be a minimum of 10 feet from the edge of the tank. And I was that's why I'm here, because my pool deck is going to be closer than 10 feet.
It's gonna be 2 feet.
Yes, that's what I'm,
And pool deck, you mean just like a concrete slab?
yes.
Yeah.
And there's still access to pump the septic system?
Yes, yeah.
Right, it won't be going over the tank.
No,
No,
I would
okay.
never do that.
Does
Well-
anyone know the purpose of that rule, that setback rule? I mean, what are we trying to prevent with it? And are we doing anything that might hurt something if we approve this? Do you know?
Yeah, well, my thought was just like putting that structure that close, the harm of potentially damaging it when putting it in would be my guess. I don't know for sure, but I mean, when you're working with that, so I'm sure contractor will be well aware and stuff, whoever's doing it, but yeah, that's my guess is you don't mess integrity of that. And I'm guessing that's why Bailey's also saying, put it in and then test it just to make sure that nothing has been damaged in the process of putting it in, is my guess.
Yeah, and that's where I was going too. I was concerned with any leaching from the septic tank into the pool might be a concern, but as long as we're observing the required distance from the pool to the tank, I'm not as concerned about the concrete over the top of the.
Yeah, I agree with you, Tom.
So I would make a move that we accept the variance.
Is there a second?
I'll second it.
Any further discussion? I have a question. Where is the septic field, Tim, if you know?
It would go north, it would go up that way, opposite the pool.
Okay.
Yeah, the field, right where the 0 on the 150 feet, right where the 0 is,
Yeah.
right? That is the vent for the leach field, the septic system.
Yeah.
So,
Okay.
We're not covering the leach field.
no.
Yeah, that meets the setback.
Okay.
And you're okay with testing, with the requirements for testing?
Yeah, just tell me what to do,
And then-
you know.
We can come swim every month.
Absolutely.
But I'm just curious, just like logistics of, I'm sure there's a reason, but why not shift the pool a little bit to meet it? I'm sure, is it,
To go in this picture to go
Right,
down.
yeah, is it a slope?
Then all of a sudden, there's you can't tell, but there's quite a bit of a
Okay.
slope.
Gotcha, okay, I assume that.
And- Yeah, and
But I just
that,
wanted to double check.
and I'm talking about a pretty big
Yeah,
retaining
yeah.
wall, and then I don't want to infringe on my neighbor's
No, right,
privacy, I guess.
good questions.
Any further discussion? Okay, all those in favor of granting the variance to Mr. Callahan, please say aye.
Aye.
Those opposed, say nay. Okay, the variance has been adopted with the requirement that there be water testing, and I assume those would be reported to the health department?
Yeah.
Okay. All right, thank you. Our next item is the Board of Health VNA Annual Contract Review and Signing.
So this is something that is brought to the Board of Health every year. Stacy and I did review it already, and we made a few changes too that I just want to highlight. This contract this year includes the funding amounts and the breakdown. That has not been included in the past, and that was a recommendation from IDPH to Stacy,
Where are those?
right there in the table on the front page.
Population health, to separate the type of work.
Correct, yeah.
Okay.
Mhm. And then other changes include under 5, G, H, and I. And then under 6, B through E, those all focus more on the VNA's reporting structure, using the reporting form that Stacy had used earlier in her report. And then meeting routinely with the executive director of the county health department. Those things are just included here in wording. They're things we've already been doing, but now we have them in writing. Is there anything else, Stacy?
No, I think increased communication is always a good thing, and it looks like you're covering that. So
I
thank you.
agree. It helps me tremendously to have that structure as well.
I have a question. What do you mean by population health and non-population?
So
health?
I don't have the contract in front of me, but that part I believe is part of the public health services. So the changes, what they've asked is that we put those specifics under our public health services grant in here. So the other grants don't ask for that breakdown.
But I don't understand the terms.
If you
That's all.
remember when I was here, I think it was last time when we talked about the changes, what they consider population health are things that would be doing to a whole group of people, to the whole population, rather than a specific group. So like our homemaking, home care aid services,
Okay.
those would be considered non-population health because it's to a targeted group.
Okay.
That's right.
Gotcha.
So, and those
Thank
are
you.
those, that 75%, 25% breakdown that they have us doing, and that will change year to year. But they did ask that we include those, that breakdown in there.
Thank you.
I think it makes it clearer for us too.
Yes.
Samantha, do you know if this has been submitted to the county attorney and or auditor?
I don't believe it has, no. I haven't submitted it.
Okay, I think we should probably, I mean, I think we could. Does anyone know, can we go ahead and adopt this with the thought that it will be submitted to the county attorney for approval? I think we can do that, right? I mean, Tom, do you know?
I think this is the first year it hasn't gone to the supervisors for signature. I know this was always taken to the supervisors in the past.
Oh, was it?
Yeah,
Sandra, can I explain that?
Yes, go ahead.
So this one never went to the supervisors. We always did an addendum with the supplemental, the deficit funding. The addendum then went to the Board of Health Chair and then also the Board of Supervisors. IDPH recommended we just put all the funding amounts in here, and then it doesn't have to go through since it's coming through Board of Health funding and their budget. And that was through the recommendation of my Department of Public Health.
Did you hear that, Tom?
yes, I did. I mean, yeah, it's within the funding we asked for in our budget, so.
Mr. Dragado's not on, is he?
No.
Well, I'll make a motion that we accept this community health nursing services agreement, subject to review by our county attorney. Is there a second?
I'll second.
Any further discussion?
Can we put a deadline on when it needs to be? Is there a deadline when this needs to be filed or?
Yeah, this goes into effect July 1st.
So we need to put the deadline
Right.
for the county attorney.
Right.
Yeah.
And I would submit it to both the auditor and the county attorney.
Is there a specific deadline that you want?
Well, I don't know, what do you? The 20th, is 10 days enough time? If there's needs to be corrections made or?
I would think so. I mean, this has just kind of been the same year to year. I think
Is
this
this
is the
July
first
20th or
time
June
we've made a change to it
It's
in
June.
years that I've been
This
here.
is due July 20th or June 20th?
This is
July
due
1st.
July 1st.
Because that June
So
20th doesn't
today's-
give you much time
No.
to do that.
I would say, yeah, we should get it back. If we get it back by the 27th,
Okay.
And just to clarify, how much has changed in this from years past, other than the table?
The table and then the little bit of wording that Sam
Oh, yeah,
added just to
okay.
outline our responsibility.
Yeah, sorry.
okay, so the motion on the table is we will accept the community health nursing services agreement subject to review by the county attorney who we are asking that he get his review back to us by the 27th of June. So I can sign it.
Yeah.
If he approves it. Okay, so any further discussion? Hearing none, all those in favor of the motion, please say aye.
Aye.
Those opposed, say nay. Okay, the motion passes. And Samantha, will you take care of submitting that to Mr. Delgado and Mr. May?
Yep, I will.
All right, thank you. The next item on our meeting, on our action items on the agenda is D, Board of Health, Board of Supervisors joint meetings preparation. We kind of started this on our last meeting and we were just gonna kind of look at everyone's information and go from there. Our presentation to the Board of Supervisors will be on the 20th, I think, right?
I spoke with Ed Raver today. He has to confirm that. Dawn Sherman is the one who typically puts those types of items on the agenda. So he had to coordinate with her, but
Okay, all right.
I can probably share something about that, Samantha. I did talk to the auditor late today. It is at 9:30 on the 20th.
okay, thank you.
And Samantha, you were going to try and find out some of the questions that some of the members of the Board of Supervisors had, and maybe we should start with that. or-
Yeah, when Sandra and I had spoke with the Board of Supervisors last, Jay had just expressed a few questions that he had or things that he was interested in learning more about when we have the joint meeting. So I just took a few notes after I had talked to him this morning. He wants to know more about how the Board of Health and the Health Department function in relation to what the VNA is doing. So some details on the VNA's role in this relationship and funding amounts, full-time employees, that sort of thing. And I think that the document that Stacy had put together for our last meeting will answer all of those questions, in my opinion. He had questions about our environmental specialist position and the increase in her workload. So we could always add points from the presentation Bailey gave to that to answer any of those questions. And he wanted to know key goals for the Board of Health in the next year and moving forward. What are the main priorities of the board in terms of VNA, department, that sort of thing?
The question about how the VNA and the Health Department, how they kind of function together, who will be answering that question?
I plan to be at the meeting. I'm sure Stacy will be there too.
Okay,
And we can provide them with the document that Stacy had put together in advance, so they can read through that
okay,
and then answer the questions that they have.
okay.
Sure.
You'll kind of add it to your presentation now, or?
Sure.
Okay, all right. Sounds good. And So I think the thing that the board has to think about is what our key goals are. And of course, one of the things we're going to be asking the supervisors for is a strategic planner consultant. So that will help us find our goals, but maybe we can tell them what some of our goals are at this time too. So just to catch you up, Adam, we are going to have a joint meeting with the supervisors, and it was originally to urge them to adopt our ARPA proposal for more staff. And that is what it is, but we don't know how they're going to decide that, but they kind of asked that we come and kind of explain it all to them. So I don't know if you're available on the,
Yep.
are you? Because we thought you might want us to talk about some environmental issue, or how the Board of Health and Department of Health could increase their footprint there. Okay, you want to just,
Yeah, so we started putting together our presentation. The first few slides are what the original presentation was. And then that will go into also the strategic planning piece. And then budgeting things and comparing our budget and our full-time employee count to other counties in Iowa. And Tom had put those together. So Tom offered to go over those at the meeting. And then a section on the VNA staffing, which is referencing the document I was telling you about. And then sort of letting each Board of Health member talk about different public health interests or needs for the community that they see. So Dr. Schultz and Amy and Jess had all sent me some PowerPoint slides to include, which I've included in the printed packets that are on the desks. Adam, we had tentatively put you in there if you would like to talk about environmental health.
Yes, when you want us.
Um,
Yesterday.
Anytime this week is fine, and we can work on it with Bailey too.
Perfect.
Yeah. And so I just kind of put them in the order I thought made the most sense. I had Hendrik going to talk about general health challenges and how that relates to Dubuque County. Then it would go into Adam talking about our environmental health needs and Amy talking about behavioral health needs, and ending with Jess, who talks about the future of public health. So yeah, it's all kind of combined into one PowerPoint. I don't know if we want to go like slide by slide and refine what we have in there, but I think it's a good start.
I think we should probably.
Yeah, I think that would help, and also to see how we can connect the pieces and make it a smooth transition, because I think it all fits very nicely together topic wise, and it just would be nice to have it as a coherent presentation from us all.
Sure, sounds good. So the first slide talks about our upcoming projects, and this was what was included in the original ARPA presentation and our budget presentation to the Board of Supervisors. And then it goes into how those projects look in the department, the way that we have our department right now. So those three lines at the top talk about, you know, the strategic planning, lack of staff, and then changes in the staff that we currently have.
Sam, can we change mental health to behavioral health?
Yep.
I was wondering too, on the upcoming projects.
Yeah.
If maybe the strategic planning should be listed there.
Yeah. Yeah.
And when you have on that slide, China have delayed, it's late already is what you're saying, right? Or we should have started it last year or something like that?
No, the Iowa Department of Public Health delayed it because of COVID.
Oh, okay.
So we'll be starting that more toward the end of the summer, I believe.
Okay.
Should we have our after action report on this as well?
Yes, good point. Okay. And then I just talk about the original ARPA proposal. The goals of that haven't changed. Next slide goes into our current staff and then our proposed staff.
Mhm.
And we actually, as 4 full-time employees, right, on the top?
Oh, yep, sorry.
Good catch.
Thank you, yeah.
And the proposed staff, those are fluid
Mhm.
titles.
Okay, I can make an
Correct.
action.
Correct, yeah.
I will clean this up.
Well, it's all just a draft, so there's things on mine that I thought had the citation, and then when I looked at it again, it was gone, so I need to.
Oh, that could be my fault too, because I merged them all into one thing. Okay,
Yeah, thank you for doing that. This looks really great.
So how long do you think your presentation is, Samantha?
mine I think will be the shortest part because the board of supervisors have already seen it.
Okay.
I mean, I can focus more on the strategic planning because we haven't talked to them about that piece, but as far as the staffing, they already have seen that.
3 to 5 minutes?
Sure. And then it goes into Tom's 5 slides about comparing the budgets and staffing from 5 different, well, I think 10 different counties now in here.
Yeah, and Samantha, I'll just make a comments here. This is divided into 2 groups of counties. First of all is the 5 largest eastern Iowa counties, which includes Lynn, Scott, Johnson, Blackhawk, and Dubuque. And it shows the differences. This is a very busy slide, but when you go to the next one, it shows 3 key measures.
Yeah.
The number of health department employees, how many people each health department employee is spread over, and what the county spends per citizen on public health. Then I've done the same thing for the counties that have a population between 90,000 and 103,000, which includes Woodbury, Story, Dallas, Potawatomi, and Dubuque. And this tells a much different story, but my point is, if you go to the next slide, Sam, it shows that, you know, we're not too far off except for Woodbury County, but, you know, those aren't the counties that we've been asked to emulate. Every time we've talked, we've been asked, what have you done, what have you compared to the large counties here in eastern Iowa? So when I go back to this, my thinking is, you know, the first comparison is the right comparison. Those are the counties that are more proactive on health. Those are the counties we're being asked to look like. And, you know, those are the counties that we really need to compare ourselves to.
Yep. That's what they invest into public health per citizen and per public health employee. Yep, I think it's a valid point, Tom.
So if you go to slide 10, I think it's the large counties are the relevant counties. I haven't gone to Polk County or anything like that because they're 200 miles away. At every turn, we've been challenged to do more. You know, we see from the comparison here that there's a lot of grants available, but you don't get grants without researching them and writing for them. And then once you get them, you need resources to do the work. A good example of what we've done is the presentation that Bailey just gave us on the grants to counties. You know, we've gone from not spending that money to spending it, but we only did it by adding an environmental specialist. I don't think the right answer is to wait to make these changes. We've got an opportunity to use some ARPA funding while it's available to fund these positions and this additional work. When that funding runs out, we need to find a way to, within the county budgets, to support this. Those are my comments. I don't plan to take any longer than that.
That's
Nice.
very good, Tom. I appreciate it. Thank you for the hard work, and I totally agree. I think you're preaching to the choir here, but.
I like that, Tom, and I think the graphs are really helpful. Is there a benefit potentially just getting rid of 8 and 9, or do you want to show those?
Pardon, I couldn't understand that.
Oh, I'm sorry. Is there a benefit in showing 8 and 9 and then saying to ignore it? I mean, like, do you want to get rid of those slides, or do you see a benefit in showing them and saying it's not a relevant comparison?
Oh, no, I plan to show it.
Okay.
Yeah. Because those are the ones that Stella suggested we use.
Oh, sorry. Okay, I missed that part. Thank you, Tom.
Yeah, that's when the county wants to prepare salaries and things like that. Those are the counties they always
Okay.
go to because they're similar
totally
in
get it.
population and.
Thank you.
Good questions. Thank you, Tom. So I would say that's probably 5 minutes at the most too.
Yeah.
Okay.
And then I put in a slide to go over the VNA staffing and see if they had questions. Do you think this is the best place for that or? Who knows?
I mean, it could go closer to the front when you're talking about staffing.
I think I would put this at a later point of time because this goes pretty much in, if I saw it correctly, it goes pretty much into the details of what that is, which I again, that's just my 2 cents on this, which I would probably put before Jess's part where she says the future of public health, so that she can connect and say, and this is why we need to expand here and do these things, and then lead over to, and this is the vision we need to have. How does everybody else feel about it?
I would agree with, oh, sorry, go ahead.
Yeah. Oh, go ahead,
I
Jeff.
would agree too. I guess the only other point I'd make is that the VNA staffing is already included in the numbers I've presented.
Okay. Yeah.
Okay.
I mean, shorter is better. Is this something let me just ask the question this way, is this something that is already so much included that we can skip these slides, or do you think there is value in these slides regardless of what is included in other slides?
I think these slides, Hendrik, specifically answer Jay Wickham's questions on the relationship.
Oh, okay. No, then I think it would be important to keep them in.
Yeah.
Definitely. Got it. Okay.
Actually, what will be behind this
I guess
slide?
this would just be a time to reference the document that Stacy had put together about staff, which
Yeah.
they'll get in advance. So maybe
Yeah.
we don't need a slide for it.
And that
Yeah.
document shows that we get about 12 FTEs from, is that?
And it shows the breakdown of the projects and the programs that those staff are working on.
Okay,
Yeah.
for the county.
And
We could, I mean, Amy suggested to put that sort of in with Samantha's speech where you're
Mhm.
talking about increasing staff. And
Yeah.
you could say something at that point.
Maybe at the beginning is
Yep.
around that time where we talk about staff is when Stacy and I can just talk about what the department looks like currently.
Yeah.
I think
Yeah,
that
I'm just thinking like, I like that.
Yeah,
that sounds like a
like
good
it.
spot. Yeah,
Mhm.
I agree.
yeah.
Yeah.
Good idea, Amy. Okay, and then Dr. Schultz.
Well, I'm gonna delete this slide too,
Yep.
and then we'll just move into Dr. Schultz.
Yeah.
Is that okay?
Yeah, let Samantha finish the
No,
transfer.
that's okay. Okay, now it's you. Go ahead.
All right. Can you pull up the first slide?
Is there? I think it's this one, isn't it?
Yep. Okay. Sorry. I saw the one below. So I wanted to highlight 2 things. The aging with rising needs of different aspects of health in the elderly, and that if you look at the demographics, we will see in a very short period of time, 2036 is not that far away from us. We will see that we have more older people, more morbid, with more needs, and we need to develop a strategy to meet these needs in the community, because the healthcare part, and this is actually, if you go to the next slide, and then the slide thereafter, the healthcare part that everybody thinks about is just a very, very small proportion of what will keep the people healthy in the community. Environmental stuff, other things like behaviors play a much more important role. And this is where we need to have a multidisciplinary approach. This is where we cannot simply say, oh, this is what a nurse can do, this is what a doctor can do, this is what a nursing home can do. We need to put all the pieces together, because these are our parents. These are our parents, our grandparents, or grandparents to be, who will end up. And if we don't do it right, we have to shoulder that burden, because I don't think there will be enough structure and enough programs in place that we can really serve our elderly population well. That is the first part that I wanted to highlight. And again, if you look at the demographics for the US and for Dubuque County, that's where we are going. The next part, this is tying into the first one. This is about obesity. As you know, this is one of the major things next to the opioid pandemic. And if you just click on it for the presentation view, Samantha, I just wanted to show a couple of things here, because I've set it up in a different way.
Oh, I see. Okay, I'll start over. Can you see that?
I think you're muted, Dr. Schultz.
That must have happened accidentally. So now what you see here is actually the cost, and this is just worldwide, are comparable to the costs tied to any armed conflict or to smoking worldwide. So we will see our fair share of increased costs if we don't address this in the right way, and that affects too the whole community. So I think it is important, if you take the first two things together, we have an aging population, but we also have a population which will not get healthier in terms of their weight and their lifestyle. If we don't tie this together, we will be in a bad spot. And if you take the next point, just click on it. This affects many, many aspects. Infertility affects young families who want to have families living in the community. Cognitive problems affects older people, particularly in terms of where do they need to live. Joint problems affects mobility of our older and middle-aged population. So a lot of things that will have downstream events that even makes our population more unhealthy. Now, if you go to the next slide, this is a study that actually McKinsey did, what interventions are working to address it. And this was their proposal. And what you see here is two things. First of all, it's not one person and one entity alone that deals with it, but many entities in a community. And the second one, again, the medical part of it is very small. And I think this is where the point comes in to say, you need parental education and community education. This is what public health does. You need counseling on what is good, what is bad to eat in the community. Just to give you an example, should you educate restaurants to offer at least 1 or 2 meals that are low salt, low fat, low sugar, in addition to everything else? But this is not something that each and every one of us can do in their spare time, because you can only drain the ocean so much. But you need somebody to really follow through with this, who addresses all the pieces in the community and puts them together. This is something that has been and is and will always be the role of public health. They will step beyond what is done in healthcare. They will step in the community where the problems arise. And this is something that takes time and that takes effort, that I think in a community of this size cannot be done with volunteers alone. We need a stable backbone of trained professionals that are dedicated to this task in order to put the things together and accomplish our mission to keep the community here healthy. And if you go to the next slide, that's what we have to talk about. We need really somebody who's a relationship builder, who's the go-to person for questions, for connections, which we learned works great. COVID is a good example for that. We need somebody who orchestrates, like Maestro Interligator does with the Dubuque Symphony Orchestra. You know, it's not enough to say, okay, you take this part, you take that part, and then we see what comes out of it. We need to make sure that this remains in line of what we want to accomplish and check on that. And it's great to have somebody to do this. This, for example, is also for the oversight person that we ask for, advocating for all community members. You know, the beauty of a public health department is they're not tied to a specific organization in the community, so they can ask on behalf of everybody, but they also need enough voice in the community present. And finally, you need somebody who cheers from the front and rallies the troop if emergent needs arise. And I think the past pandemic really showed very well how important the role of public health is, because this all was sort of driven by public health, getting the players on the table and getting us to the place that we are at right now. So this is really something that we cannot do half-hearted with volunteers or just with the leftover time we have or half staffed. And it's still a lean model, in my opinion. So I think that would be my selling point, and putting the more global health problems, how they will affect us in the community here, to make the case for our staffing request. Any feedback?
This is great, and I think more or less we have to show that the health department has to be the leaders in pursuing all this. We need to be the leaders, and to be the leaders, we need the staff to do it.
Yeah, I think maybe Samantha, if you put this below that sentence, the last sentence, public health department needs to be the leader. That's, I think, a strong point that I would want to include.
I love that. It can't be done half-hearted or half-staffed. I love that.
Yeah, I had a different wording for it initially, but I kept that to myself.
That's very good. I think that's going to be very persuasive, Doctor. So, thank you. Any other comments? His presentation, Dr. Hendrik Schultz's presentation was about 7 minutes. I was timing it, so.
Yeah, and I can make it shorter. I can make it shorter.
Okay. All right, so the next one then is Amy.
Yeah, and what Dr. Schultz says segues very nicely into what I have to say, which is public health and behavioral health is a public health concern. And we would be maybe first in state to have behavioral health be a focus, because nobody does it. It's all physical health, it's not behavioral health. Slide 2 defines behavioral health. And the reason I tend to ask Sam to change mental health to behavioral health is because behavioral health is population-based, kind of like what Stacy was talking about. So it's not that specific mental health, which is client-based, but it's population-based. So what can we do to our whole county to make us more healthy physically and mentally? The other thing that segues very nicely into what Dr. Schultz was saying is we need to have partnerships between our mental health therapists and our nurses and doctors in town. We need to get releases of information and talk to each other. We need to have behavioral health questions be part of a physical health assessment and just have that be part of what's going on. Stacey, I think you are doing some of that already with the VNA, but we need to expand that into all of Dubuque County's clinics and healthcare centers and long-term centers. So the other thing with behavioral health that's a little different than mental health, behavioral health is more short-term. It's finding the issue and solving that problem. It's problem solving and crisis intervention. And mental health is more long-term treatment, where you have treatment plans and you review so those are the two differences between behavioral health. Also includes substance use treatment, whereas mental health is basically just brain health. Next slide. So public health focus means healthier citizens, just like Dr. Schultz said. Public health aims to promote healthy lifestyles as well as to detect, prevent, and respond to diseases. And those diseases are not just physical diseases. Those are things that affect people through their brain health in this county. So again, like I said, we need to make behavioral health an integral part of achieving our public health goals. It's just got to be a focus along with physical health. Next slide. SAMHSA is the Substance Abuse and Mental Health Services Administration. It's a nationwide organization, and they have put out a quote that says, anxiety, depression, and mood disorders have the biggest effect on the health of Americans. And as you can see with the little graphic, there's just some statistics in there. People of color are less likely to have access to care. Of course, we're seeing that in Dubuque County. Children with anxiety disorders are less likely to receive treatment. And sometimes that's because there aren't enough providers. Sometimes that's because schools don't have the resources to help kids with anxiety disorders. So these are just things that we can key in on, the short-term things that we can key in on and make a real difference. The PTSD, we're going to see PTSD exploding because of COVID-19. So it's not just a thing that happens with war or tornadoes or things like that. It happens with pandemic responses as well. So that's where kind of the focus of my presentation is going to be, is on those mental issues. So next, this is a lot of statistics, but again, these are worldwide statistics, but brain health issues account for 25% of disability in the United States, and they're the leading cause of premature death. So you get diabetes. Well, what goes along with that? Anxiety and depression. You get diagnosed with obesity. What goes along with that? Anxiety and depression. So they just go hand in hand, the two disciplines. And I would like to see that be more focused upon in Dubuque County. So 22%, that's almost a quarter of the US adult population, has one or more diagnosable brain health issues in any given year. And 29% would be anxiety, 25% impulse control, 21% mood disorders, which is your depression, and 15% for substance use disorders. And I didn't put the last one in, but 49% of the population could have a combination of any of those. So that's almost half of the population.
That's a lot.
Yeah. And then we go on and look at the children. 1 in 10 has a brain health issue that causes some level of impairment, which of course affects their schooling. It affects their peer relationship. It affects sometimes their physical health, because they can't keep up with their peers. They get teased. They get, I don't know what else, but I will think of that before.
Well, also, brain health affects your immune system.
Right.
And then you're subject to a whole host of things.
Yes.
Cancer, everything you have listed there.
Yeah. So, and then to, I guess, kind of put it in money issue or money talk, it costs the United States $150 billion annually, brain health issues. And that's a lot of money that we could help keep in people's pocketbooks instead of paying for medications and doctor's visits, if we can really focus on brain health issues.
An ounce of prevention.
Yes, yes. So next slide. So again, back to COVID-19, we have been living with this for 2.5 years, and that has caused information overload for many people. And people are experiencing increased stress, fears, anger, sadness, loneliness, and worsening brain health issues like anxiety and depression. At the same time, rumors and misinformation have made some individuals feel like their life is out of control, and control is one of the biggest things in a person's life to staying healthy. And if we feel like you're out of control, you will do things to get back into control. And that might include starting to take drugs to make yourself feel better, starting to drink more frequently. Yes, yes. Hanging out and doing risky behaviors. And so we need to keep brains and bodies healthy. And so depression's effects on physical health. Marcia, you already kind of talked about this a little bit, thank you. But it's associated with elevated morbidity and mortality. And some of that is because, of course, suicide can be a result of depression. And Then there's other things like I said, the cancer and diabetes that people can maybe diagnosed with, but in and of itself, depression can have the same magnitude of physical impairment as those diseases, which I think is pretty mind-boggling, and that we don't really focus on. So next slide. Anxiety, same thing, that there is just a very big correlation and connection between brain health and physical health, and that we really need to be looking at generalized anxiety, especially after coming out of COVID, because a lot of people are experiencing anxiety. Anxiety looks a lot like those symptoms for obesity. It looks like pain in your joints and muscles, which people don't always understand that is a side effect of anxiety. It's irritability, it's difficulty sleeping, it's restlessness, it's fatigue, as well as excessive worry and impaired concentration. So we need to treat brain health with the same urgency as physical health. I think I've talked about this previously as I've been going through these slides, but it is just as integral to overall health and well-being as physical health. And we are going to have a brain health crisis if we don't address this. And we need to help people learn how to communicate better. We need to help people learn how to problem solve more efficiently and effectively. We need to help them learn how to solve conflicts more efficiently and effectively. So the treatment of behavioral health is available. I think I already kind of talked about this too, that we need to really start having a partnership with our physical health care providers to do the awareness of brain health crises and remove that stigma that's associated with receiving treatment. Of course, one of the biggest barriers in actually the whole nation is a shortage of providers, and Dubuque County is not immune from that. But I think if we can start having that bigger safety net of both physical providers and mental health providers working on this issue, it's going to go a long ways to making our community and our county a healthier place to live. So next slide. That is a graphic from 2021 statistics. Again, it's just showing that things are increasing with mental health not being served very well, that people are not feeling very good about themselves, and they're not feeling very good about their brain health or mental health. So how can behavioral health be integrated into public health? Again, we need to just start talking, and we need to start working together, those community partnerships that we need to establish. We need to, as a public health department, have a better relationship with Crescent Community Health, with Hillcrest, Family Services, with area providers, and just talking, maybe having some roundtable discussions, getting monthly or quarterly meetings together with providers, and working on getting people more comfortable with talking about behavioral health issues. Okay, last slide, I think. So the next steps are an expanded Dubuque County Health Department, and that could partner with Dubuque County offices to better meet brain health needs of Dubuque County residents. And the partnerships I would propose are having a better, stronger relationship with mental health disability services. I would even propose that she should be, that person should be moved out here to this office to really collaborate more openly and transparently with the health department. I would really love to see more partnerships with the conservation department, with outdoor activities, and I think it could be a really cool thing to plan programs that have both a behavioral health and a conservation focus. I think we could work better with law enforcement to make sure that behavioral health needs are being taken care of, and that law enforcement themselves are taking care of themselves. They see some very, very traumatic things, and I'm not sure that they get the support that they need. And I think the health department could help with that as well. So Again, the 6 keys to mental health are kind of the same as the 6 keys or however many keys there are to physical health. It's the social part, it's the staying active, it's managing your stress, brain, a healthy diet, quality sleep, and meaning. I mean, it just all goes hand in hand with each other, but we just have never focused on it like that before.
There's a ton we can do. I
Yes.
mean, it's,
Yes.
yeah.
Yes,
Your presentation was just about 12 minutes.
I know, and I will cut it.
So you can cut it a little bit.
Yes.
But it's very good.
Oh, it
And
is.
We felt
I
the
could talk for
passion.
Hours, Sandra, hours.
It looks like it.
Semesters.
Yeah.
I thought it was very good.
Yeah.
Now, do you have any concern with, I'm always hearing that, the county can't give out any money for mental health anymore. It's regional now. Does that have any impact? We could still do it. We just get the money from the region, right?
Well, I
Or-
think if we partnered with the mental health disability services, that would help solve that issue. And I mean, in my mind, as I'm writing this out, I'm thinking the lifestyle specialist
Right.
would be
Yeah,
able
and I
to
would-
do a
I
lot
would
of.
put that somewhere specifically, because I was
Yeah.
just looking at it too, like
Yeah.
you say, what are the next steps? Well,
Mhm.
that
Lifestyle.
just specifically
Yeah.
match that
Yeah.
up.
Yeah.
Okay.
That's a good idea.
Yep. So,
And I'm, oh, sorry. I wonder if, great job, Amy. I wonder if what are the next steps? I like how you have it as a summary. I just wonder if I don't know, do we take next steps from each of the different topics and make kind of a summary slide, or I'm not sure. Just a thought.
because we're all kind of saying the
We have to
same
pull
thing.
it together.
Yeah, we're all
We
kind of
could
saying the
have-
same thing.
Yeah, we could have like a closing argument.
Yes.
And that just summarizes everything, but I kind of like the idea of having this next steps after each segment also, just to keep pounding it in that none of this can be done unless we have more staff. Our
Yeah.
current staff cannot do any of this,
Right.
basically, so.
Right.
So,
That's good.
so do you think we need a summary at the end, or? I don't know, it's kind of I'll
It
see.
doesn't have to be long.
Long,
I mean,
yeah,
it
yeah.
can simply be that we've demonstrated the why, the very broad need. And we need to be the leaders in solving these problems. We
Right.
we need to be the leaders, but we need the people to be the leaders, right? We need people
Mhm, mhm.
to do it.
And I think that could be your role, Sandra, is tying it all together.
Yeah.
Doing
I'll
the
do
recap.
the closing argument.
Right,
Yes,
and
yes.
it doesn't have to be long-winded. I mean, it just
Right,
to
it
the
won't.
point.
It
It
doesn't
won't
have
be,
to be like me.
No, that's very good. And maybe Samantha, could you make a slide for me that just puts all the next steps that we've listed in the other sections, and then I'll just summarize it all.
Yeah.
Okay.
I'm thinking I'll just put together the edits we're talking about tonight, send it out to the group tomorrow, and then everyone can send me back their own individual edits, and then I'll get a final copy out to everyone.
Okay, sounds good.
Okay.
And then Jess, you're next.
Yep. So my focus is really going to be on talking about kind of where public health is and has been for the last, 75, 100 years. And especially as a result of COVID, where it's going. So up until this point, we really had a pretty fragmented or siloed approach. Both in public health and in healthcare in general, we target specific symptoms or specific diseases, but we're lacking that initial prevention. So we're spending a lot of time treating diseases, preventing worsening of diseases. But if we had started at the beginning and invested the time and the money and the grants and the funding early on, we may not be kind of down the road where we are. We have right now kind of an inconsistent funding structure to many of our public health initiatives. Most of them are based at least partially on grants, which although grants are routine, you never quite know if you're going to get them. So looking ahead, actually Deloitte has done a ton of work on goals for public health and public health in the future, really focusing on a little bit of a more holistic approach and prevention of the complicated disease states. Next slide. So really, I think there's kind of 6 factors that we need to consider. And when we think about what public health is going to look like in the future, one of those is ecosystem partners. So really looking at our environment, our community as a whole, and pulling in people from every kind of avenue of society. So nonprofits and the private sector. Public health in the future, I think, will be a community effort led by the public health department as a convener of the organizations, as opposed to kind of the center of the organizations. I also think we're going to see a much more blended funding structure, and that's because we're going to have to for a few reasons. One, it's expensive to provide public health. 2, that's the best probably way to get buy-in and investment from more people. So when people are invested financially, emotionally, they're just going to be more committed to an activity. I think it's important to note that while public health is expensive and the work we're doing is expensive, the lack of public health is outrageous, and the cost it's not even comparable. So the investments need to be there. The third, I think, area where we're going to see some growth is in data and kind of streamlining data. So using more shared databases, more standard data collection tools that can provide predictive analytics and a better job at population health monitoring. So right now we have a variety of different health systems, public health departments, state health departments, federal health, all collecting data in their own individual ways. And that's all really valuable, but until we can pull it together and holistically identify trends and concerns and areas of opportunity, we're not going to see really the changes that we need. Next slide. So shared value. So we all know kind of what leads to healthy lifestyles. We know that outdoor space and clean water and healthy food and regular medical care and prevention, what we're lacking is kind of that collaborative effort. So when we invest groups and when we bring community partners together, we are more successful when we do things together. And then also honest communication. I think there's been, especially with COVID and social media, there's been a lot of distrust of multiple routes of communication. And so I think there'll be a real concerted effort by public health to not only provide honest communication and data-driven communication, but also communication in a way that meets people where they are. So using social media, using TikTok and Snapchat and all of those things that people are using to get information, as opposed to maybe some of the antiquated communications that we've seen in years past, more, I guess, formal and top-down approach. It really needs to be you need to meet people kind of where they're getting their information. Certainly a multidisciplinary public health workforce that includes, racially and ethnically diverse, also including a multitude of different disciplines. So, public health is going to need to include marketing and engineering and all of these different areas of study that maybe initially don't seem to be related, but really are when you're trying to get services to people where they are. And then finally, just an increased focus on health equity, really closing the gap early on in people's lives, so that gap stays, closed as we progress through life. I think we know that once there's a gap in equity, usually we just see that kind of continue to expand throughout the rest of the life. So I think that's where public health is going. Next slide. Oh, sorry. And that just kind of exemplifies those 6 dimensions of where public health is going in the next probably 20 to 25 years.
Okay, Jess's presentation was about 6 minutes.
She wins the prize.
Yeah.
Thank you, Jess. That's very important information. I think that'll be helpful. And anybody else have anything?
I think, Sandra, I think your closing remarks would tie perfectly in right thereafter, saying so that it is something that you require enough hands on deck. You need to man the lookout, and you cannot simply skip part of the multidisciplinary components that this problem solving tool needs. I mean, that's really the one part where I feel we should highlight that, you know, if we want to be effective and meet the challenges ahead, and also the challenges of shifting from a curative approach in treating populations where we actually step in after the fact when they're already sick, but we want to get them to a point where they don't get sick to begin with, you need people who serve as a platform. I mean, similar to what a platform is like whatever cheap flights where you use just the platform to bring people together for certain things. And this is, I think, where you need enough specialists of enough diversity in a public health department, so you can get all the people you need on the table, but you cannot, you know, not all you need the public health department as facilitators in all these different aspects. And I think that would be my case.
Yep. All right, thank you. Let me just pose a question that we might get asked. Why should the supervisors approve something now? Why shouldn't they just wait until we get our new executive director? Why should we do it now? What's the hurry? Any ideas?
It's
Well,
the fun.
I think, I think the new director is going to be coming in and playing catch up anyway. And I just think it would be unfair to say, well, let's just push it off and let the new director handle it. I think that's too much. I think it's an overwhelming task.
And also, this is our vision of what the department should be and should be able to provide to our community, regardless of who the executive director. And we hope that whoever we hire has that same vision.
That's a good point, because the Board of Health is the policymaking body for the county for health-related matters. So it isn't the executive director that really makes that vision. It's us. So that is a good point that I think we can bring up. But I think we will be asked that.
I think you're right.
Yeah.
We should be.
Well, I mean, yeah, I think, there's some lag time before these things fall into place, and we just got together through the worst pandemic probably of our lifetime, and we learned very many valuable lessons. I think if you postpone to implement the lessons learned now, that will not serve our community well.
Thank you. Good answer. All right. Anybody else think that looks good for a presentation? And Adam,
what would you,
Yeah, so
what would you add?
Yeah, so I would say, it was beneficial for me for hearing your guys' spiel, so thank you all. But working with Sam and Bailey, I think two things I jot down. I mean, equitable access to the benefits of both the built and the natural environment. So thinking about benefits of nature and living close to stuff and parks and stuff like that. So there's clearly benefits there as well. And then the other side of that is decreased exposure to bad stuff. Right, so being able to, like Bailey is doing, being able to track stuff like that. Because I think, like Henrik said, we don't want people to get sick, but not only that is we want people to live their best life. So it's not just not getting sick, but what are the other benefits we can get above and beyond. And I think just looking at like our staffing right now, Bailey can do some of this stuff, but removing some of the other tasks you can do, we can focus on this even more to get full benefits of ecosystem services and stuff. Like Henrik talked about obesity, so impacts of getting out with nature stuff, behavioral health. There's lots of benefits of built-in natural world there as well. Stacy talked about lead. So is lead exposure, is that uniform in our community or not? So we need to know those types of things. So I think there's, yeah, lots of stuff that I would tie in there, but those two things, decreased exposure and equitable access, are two really important things that Bailey, when freed up, can help look at those types of things. And some of those will also fall under the behavioral or pardon me, lifestyle specialist as well. But I think, yeah, adding more people will just, and it was the term that Jeff used was the holistic stuff. That, I mean, this is a small piece of everything there, but the built-in natural environment is an important piece of that.
I don't think Dubuque County can be a leader in public health unless we fully fund public health. And we are not fully funding public health.
Good point.
I think the other two comments I would say is, you know, the United States spends like twice as much on healthcare as other developed countries. So we know that for every dollar we invest in prevention, we can save, you know, 4 times that in treatment. So we are asking for an upfront increase in dollar amount, but the payoff hopefully will be, you know, more than 4-fold.
I think the other part you can also say, and I don't know if this is a good answer, is and this is building on what you just said, Jess, you know, we should not think about this in terms of budget cycles and in terms of election cycles. We have to think about this in terms of, okay, the lifetimes of our community. And I mean, just on the insurance end, to give you an example, the cycle of any insured person in healthcare is 1 year, except for Medicare. So you think in these terms, which is totally wrong if you want to move the needle in terms of health and prevention. So if we try to launch this as a community, we have to say, okay, we need to get structures in place and funding in place to support these structures that help us achieve our goals over a longer period of time than just a year or 2 or 5, but really going forward. And I think that's what we need this staff for. This is what we need to accomplish. That would be my 2 cents.
Part of our request at the Board of Supervisors meeting, we agreed to this at our special meeting last week. We are asking for a consultant for strategic planning, and I think you'll have that in your presentation, Samantha, that request. And so, and we're gonna have a budget sort of for that too, I think.
Yeah,
Yeah.
I can add that.
So I think we have a pretty good chance of getting that strategic planner out of ARPA funds. I do think that we do really have to show the supervisors why the Department of Health should be a priority. So I think what you are all going to present is going to be very helpful, very persuasive. So I appreciate that. And fingers crossed that we get more staff.
I'll make the edits to this and then I'll send it out to the group tomorrow if that works.
Yeah. I have one quick question because I have to hop off soon. Will we all be there in person in the courthouse on Monday? Is that the plan?
I think some people can be there via Zoom, but it's an actual special meeting, so we have to have at least 4 people there.
Yep.
I can be there.
I plan to be there too.
Oh, good, thank you.
Yep.
Marcia, thank you. And you're gonna be there. Okay, well, we're gonna have a quorum there, but if you can't be there, then just come in on Zoom so that we're all represented.
Yeah, it's 9 o'clock or 9:30. I checked the agenda on the webpage and it said 9 o'clock. So just want to make sure that I show up at the right time.
What did Supervisor McDonough say?
Supervisor McDonough said 9:30, but I
9:30?
tomorrow and.
Yeah, 9:30, I think, yeah.
The 9 o'clock references the time that the Board of Supervisors have our regular meeting.
Oh,
And
okay,
then
got
after
it.
we conduct our business, we go to work sessions and you're the first work session.
Gotcha.
Estimated
No,
9:30.
just want to make sure I'll be there. Thanks.
Supervisor McDonough, will that be 15 minutes or a half an hour, do you think?
You are an ARPA request, so all of those are scheduled for 15 minutes, but you can certainly go over and obviously you will.
Yeah.
I alone could go 15 minutes.
Yeah,
and-
so everyone that's going to be speaking, do try to
I will
compress
not go 15.
Yeah, do compress your speeches a little bit, because we've got a good 25 minutes if we all just speak a short
If
time.
I could just offer just a strategic comment. Dr. Ann Cameron Williams, who is the disabilities director, and she is a county employee who does the mental health for the region. She is frequently before the Board of Supervisors, Amy. A lot of the things that it's in your presentation, she would already have kind of addressed with us. So I think your next steps are probably going succinctly to that. The next steps are really what's the missing, kind of like so we have this funding from the region and so forth, but what are the next steps? So I think that kind of goes strategically to what the Board of Health needs to do.
Okay. Any other comments about our presentation that we'll be giving? Okay, I look forward to seeing everyone there. Our next item on the agenda. Yes.
I'll hop off. Yeah, no,
Okay.
I have to leave. Yeah.
Goodbye, thank you.
Bye.
Unfinished business, executive director position updates, and I kind of did that. We are reviewing the applications this Friday via Zoom, and we got to just glance at them today. And like I said, we have applications from all over the country, so.
There were 23, I think.
I think so, yeah.
So, yeah.
And then, but our recruiter has compressed them a little bit. We're down to, I think, 10 maybe.
Yeah, well, yeah, she sent
Yeah.
her.
Good number.
Yeah. So, and then the assistant director position, do you want to say something about that, Samantha?
Yeah, we had 7 applicants over 2 weeks, the 2-week time frame that it was posted. And so I scheduled 4 interviews so far. 2 are tomorrow afternoon and the other 2 are Monday afternoon. 2 are Zoom and 2 are in person. But if anyone from the Board of Health is interested in joining, I know Amy said that she could be there. I think it would be good to have some Board of Health representation at those interviews.
Will it be in here?
Yes.
Do you have the time?
The in-person on Thursdays at 2. And then the Zoom is right after that at 3. And then on Monday, the in-person is at 2:30 and the Zoom is at 3:30.
So, 1, 2, you're doing 4 interviews.
Yeah.
So you kind of, there were some applicants that weren't quite qualified or?
Yeah, based on our educational background and the way that the job description laid that piece out.
Okay, all right.
I could help on Monday. I can't help tomorrow, but I could help on Monday.
Okay, great.
Yeah, thank you.
Then the clerk position. Do you want to say something about that, Samantha?
Yeah, I just wanted to let you know that Tina, our new office clerk who moved from county attorney's office, started on Monday. So we officially have a full-time clerk in the office, which will be good once she's trained.
What's Tina's last name?
Dalbenberger.
Yep.
Oh, what?
Dalbenberger.
Delvenberger?
Daubenberger.
Yeah, I think so.
Okay. And maybe she could come to one of our meetings so that we can all meet her.
Yep, I did invite her to this one, but she had to leave right at 4:30.
Okay.
So we'll try next month.
Great. Okay, is there any new business? And does anyone from the board have anything they'd like to communicate or report to the rest of the board?
Well, I attended the last Wellness Coalition virtual meeting on June 9th, 2022. And a lot of the conversation was about implementing ideas from the Healthy Hometowns, the concept of healthy hometowns, and food insecurity was felt to be a big issue. And again, it was an issue of how much interest the group had in implementing things to solve that problem. And it was an issue of getting a leader to facilitate the whole thing. Now, Sam, the gal Ann Cameron Williams, she offered to be a leader. What group is she from? I didn't.
She is the director of the Mental Health and Disability Services
Okay.
Department.
So okay, anyway, she offered. But again, what struck me was, again, we're having troubles. The issue is finding someone to lead. And that's why I thought, well, this is what the health department should be doing.
I
thought that was
agree, and I
interesting.
think that I've thought about stepping up as the champion for that group in the past in those meetings, because that's been the conversation the last few, but I think it's a capacity issue.
Right.
And I think it's a capacity issue for other people on the call. Nobody has the time to dedicate
And
to other
that's
projects.
why we need to expand our health department. So that's why I'm bringing that up, because here's another issue where we need to expand our health department to take care of this.
Right. Thank you. Thank you, Dr. Horowitz. Thank you. All right, any other communication or reports from the board? Our next regularly scheduled meeting will be July 20th at 4:30. Public comments at this time. Anyone may address the board on matters of which are of concern to that person and which are not agenda items. Please raise your hand on Zoom, state your name and home address. Please be aware that the board is limited in their ability to respond to such inquiries, and Iowa code prohibits the board from deliberating or acting on items not appearing on the agenda. Individual remarks are limited to 3 minutes. Are there any public comments? There are none. Do I hear a motion to adjourn?
Nobody wants to.
I am so moved.
I will say.
It's been moved and seconded that we adjourn the meeting. Any discussion? Hearing none, all in favor of adjourning, say aye. Aye. All opposed? Okay, we're adjourned. Thank you, everyone, for the hard work, and we'll see you Monday at our, that's our next special meeting. That's a meeting Monday.
Monday with the Board of Supervisors,
Yeah.
Good work, all. I appreciate your commitment and passion. I look forward to seeing you on Monday.
Thank you.
Thanks.